That'd be great.
Yay.
So welcome everybody. Welcome to what we call a parallel plan workshop. So today we're going to kind of talk about, having a backup plan in the case things don't go as planned. And so we'll get started today. We have a number of guest speakers here today that are going to talk about different programs and also just different opportunities within our university and outside our university. Um, so today, why have a parallel plan? We usually highly encourage everybody to have a backup plan. A lot of times things don't go as planned as in this life, as we can all probably attest to. So we want students to have a backup plan to kind of create a positive mindset. If a student possibly isn't admitted to the nursing program, think of it as a small setback rather than a failure. We just want students to have a proactive approach, which might help relieve some stress that you might have. And so if you guys do have questions along this presentation, just feel free to ask them in the group chat and we will try to address them at the end, or we can also address them as we go along our presentation here. So without further ado, I will leave it to Ellie to kind of talk about a little bit more into parallel plan options.
Thank you, Lorelei, and thank you, everyone. When we talk about a parallel plan, what we're doing is we're aligning the classes that we told students who are pre-nursing students to take with other majors. And this absolutely does not suggest that we don't believe in you and we're not here to help you do whatever you can to get into the nursing program. We're excited about that, but we also have found that people who have some extra thing in mind are a little more able to relax in their various semesters' performance. So I liken it to just hitting balls on a driving range as opposed to trying to drive in the Masters, because you're going to believe that the whole world is watching and there's so much riding on it. Whereas if you can just be a little more loose, you sometimes perform better. I have seen it many times in my years as a pre-nursing advisor. So we want to help you not only do well in the 8 courses, and if you're here and you're a pre-nursing student, you know them already, but I'll say them one more time. Basically, you need 2 semesters of what we call foundation writing. You need Chem, 2 semesters of A&P, Psych, Stats, and Nutrition. Those are the prereqs. And we have noticed that in addition to those, as you usually work your way through the grid, you do pick up foundation classes that are outside of our prereqs, like UF 100, UF 200, and maybe foundations of communication. And the good news is that foundation writing, UFs, foundation communication, Chem, A&P1, Psych, and Stats are all foundation classes, which will fit into many, many, many other majors. This is why we are encouraging people not to think that we're trying to turn you away from a pre-nursing curriculum, but rather to give you a sense that you are accomplishing more than just getting the prereqs so you can apply. Slide.
Yeah, and there are a number of different options at Boise State. There's a few different options. You can, potentially pick a parallel plan of a major that's within the College of Health Science, or you can pick one that's outside of the College of Health Science. As Ellie just displayed, many pre-nursing classes can really account for any other major at Boise State. So we're going to kind of dive a little bit closer into some of these requirements and how they can be used in other areas.
All right. Thank you, Lorelei. So within the College of Health Sciences, the classes that you are working so hard to take in a pre-nursing curriculum, many of them translate over and fit into prerequisites for radiology, respiratory care, social work, what we call pre-professional studies, the health studies, both general and science majors, public health, and kinesiology. We're going to have great presenters from many of these majors talk to you in a little bit. And if any of them interest you and you don't get your question answered, you can always reach out to your regular pre-nursing advisor and we'll help you get in touch with someone who advises for these. So for many majors, these classes will translate, as I said. Foundation writing, for sure. You can use either of those Kims, as a foundation natural science, not biology. Of course, you can use Bio 227 as a foundation natural science biology. Psych is a foundation social science class. Stats is a foundation math class. There's the foundation of whatever university foundation classes. There's foundation communications. We typically also, if students need a class to be at full time while they're doing these prereqs, we can help you take a class that would satisfy foundation arts and foundation humanities. And that is pretty much a minor. It's certainly, as far as satisfying classes are concerned, it would pretty much get you done with core, and you could even declare an associate's degree. The ones that don't automatically shift over and translate perfectly into every other major we're going to talk about are nutrition, the second half of A&P, pathophysiology, and microbiology. Patho works with a lot of our other degrees. 228 works with a lot of the degrees we're going to talk about today. And generally speaking, I have yet to advise to any major that doesn't need electives. So 207 and 205 can get you a bachelor's degree just by satisfying elective credit. All right. Outside the College of Health Science, we have some folks who you could contact. We did not manage to get people from those majors into this parallel plan workshop, but if any of those majors interest you, please contact one of us and we will help refer you to somebody who can explain the degrees out that those and some others that we've listed.
Awesome. Thank you, Ellie, for sharing some of those general requirements. And if you do have questions on, foundational requirements, the Boise State University website is a great place to look at those requirements. And also you can always touch base with your advisors to see which requirements you're meeting as well. So now we kind of want to turn it over to guest speakers that are within our university. So I'm going to leave it over to Candace. And if you want to talk a little bit about the nursing program.
Hey, thank you, Lorelei. I believe most of you are pre-nursing students. And the big question you have if you don't make it in is, what can I do? What should I do? So I think it's really great that the advisors are showing these parallel plans. Again, not to say, well, you shouldn't continue to try to get into nursing, but maybe there is something else that you really want to do and that you might be able to get right into. As most of you probably know, our nursing admissions requirements, we require a cumulative GPA of a 2.5 or higher to even apply. So that's, if I don't have a cumulative GPA of a 2.5 or higher, I can't even apply to the nursing program. I'm not ready. Then you have your admin GPA, which consists of those 2 A&P courses, that stats course, your chemistry with the lab, and your nutrition course. Those courses together must be 3.0 or higher. And then typically you have the Kaplan admissions exam. This previous cycle, we waived that exam. And the reason we waived it was because due to COVID, our testing center doesn't have the ability to allow you to come in to test. And so we have actually waived it for the next cycle too. So the cycle that begins, that opens January 1st and closes on March 1st, that Kaplan admissions exam will be waived for that cycle as well. So you've applied and you find out that you didn't get in. So what do? One option is to reapply. You would work with your academic advisor. Your letter should indicate, why you didn't get in. So you could work with your academic advisor, get ideas like, okay, should I repeat this? Should I take something else over here? Whatever questions you have about what you can do to better your application. And I work really closely with the advisors, so they can always reach out to me. And I reach out to students as well if they reach out to me with questions about what they could do. There are other ways to earn a Bachelor's of Science degree in nursing from Boise State. And that is with our online RN to BS program. What this program is for students who are either currently enrolled in associate degree RN program or students who have graduated from an associate degree RN program and are working as an associate degree registered nurse. We have a lot of students that go to CWI, NIC, all of the community colleges pretty much in Idaho and surrounding areas that will do what's called a dual enroll with us. So what that dual enrollment is once they've hit the second semester of their nursing program in the associate degree program, they can apply to start taking classes with us. And most of those programs take classes in fall and spring. It allows them to take a few classes with us in the summer, just so that they're staying on track, trying to reach that goal of a bachelor's degree in nursing. We have a specific set of classes that cannot be taken until you're a licensed RN. So with that dual enrollment, there's a certain set of classes you can take, and then you're on hold until you graduate from your RN program and pass NCLEX. But then you can finish up our classes, and then you would graduate with a Bachelor's of Science degree from nursing, the exact same diploma that you would get as our traditional program.
Candace, we have a question from one of our attendees who asks, how does the nursing program view those who repeat courses?
Great question. So when we're scoring applications, we do look at repeats. We look at excessive repeats, I should say. So if you repeat 1 or 2 courses, that's not really going to impact you as bad as if, say, you've repeated every one of your admin GPA courses and maybe even repeated a couple of them twice. That's something that drastic is going to impact your admissions, but not minimal repeats. I hope that's helpful. So I talked about the RN to BS online program, but then you have other options. If maybe you're not totally set on nursing, maybe you applied, you were going to be a nurse, but when you didn't get in, maybe you've started thinking and reevaluating things and thought, well, maybe there's something else. You check out these other health profession majors that are in this presentation, and just go with the advice of your advisors and see what's out there.
That's awesome. Thank you so much, Candace. I do have one more question in chat. An attendee asks, if I am taking 2 repeat courses for the admin GPA this spring, would that mean I can't apply to the nursing program for fall of 2021, or could I apply in spring 2021?
Okay, so the application that opens in spring of 21, which opens January and closes March, is for fall. If you are repeating admin GPA courses in that spring, when that application cycle is open, we have to look at the grades that you've already received. So we can't take into consideration that you are repeating that course. We have to look at the grades that you've already received. Did I understand that question correctly and answer that right?
Yes, I think so. That certainly would have been my advice.
Yeah.
It has to be the grades that are posted. It cannot be grades in progress that have impact on the admission GPA. And as we all know, the admission GPA minimum is 3.0.
Yeah.
Another question is, if we don't get in this cycle, can we reapply for January cycle, or do we have to wait a full year?
Nope, you can reapply. If the Kaplan exam was involved and you wanted to repeat that, you would have to wait to repeat that. But the Kaplan exam's not involved, you're not repeating that or anything. So yeah, you can apply right in the next cycle. However, if you are wanting to retake some courses, or if you're doing anything to better your GPA, then you might skip a cycle, because again, you can't apply with in progress grades.
That was very well put. Does that make sense to my attendees who are asking these very good questions? Okay, a virtual round of applause for Candace.
Awesome. Thank you, Candace. So now we're going to hear from a few other departments outside of the nursing program. Tina Freeman, if you want to talk about kinesiology.
Thank you, everyone. Good morning. I'm happy to be here representing the Department of Kinesiology. As Ellie mentioned, many of the classes that you would take as prereqs for the nursing program translate over to kinesiology very seamlessly, including your writing, your statistics, your anatomy and physiology, psychology, chemistry. All of those are within the kinesiology program as well. We do offer a Bachelor of Science in Kinesiology with 4 different emphasis areas currently. The first one is biomechanics. That is going to be very engineering and math-based, typically for students that are interested in going into orthotics, prosthetics, gait analysis, research, even working at Nike shoes. Then we have the pre-allied health, which is a great pathway for pre-med, pre-physician assistant, and other clinical-based programs like chiropractic. Pre-athletic training, just like it sounds, it is a pathway to apply to a master's of athletic training. Now certification nationally does require a master's level certification. And then exercise science is the most popular pathway for our pre-physical therapy students, but it offers a lot of different other opportunities as well. Things like health and wellness, health coaching. You could work in clinical research, occupational therapy. It's pretty broad. It has a lot of upper division electives that allow you to easily complete a minor at the same time. Really a great fit for those that may not be entirely sure what they want to do long-term. And then we also offer the Bachelor of Science in K through 12 physical education. Along with that, we have the health teaching endorsement and the sport coaching certificate. If any of these interest you as an alternative pathway, You can contact your advisor, Ellie or Lorelei, and they can get you my contact information and we will chat. Thank you, Ellie.
Oh, Tina, thank you so much. Does anyone have questions for Tina? Alrighty, a virtual round of applause. Yay, Tina.
Awesome, thank you. So now we will move forward and hear from Callie.
So welcome and very glad that you are here today. Please know that I am probably the longest time member of the I Have Changed My Major Club. Started out in nursing and realized when it was time to go to clinicals that I wanted to be more on the prevention side. And I also have taken chemistry twice. So I can empathize with students who are retaking classes, but I'm here to talk about public health. And please know that the courses that you take for the nursing program definitely connect with public health. And as you can see within that wordle, really public health touches every aspect of our life and what we are living through, surviving through, however your emotions are today with COVID is public health. And so public health, we really are focused on prevention, but we are definitely connected to healthcare. So the great thing about public health is that with prevention, it really does save us a lot of money as a community. It is all around us. We work everywhere. So we have public health people that work on campus. Our Bronco Fit program is an example of that. We have public health in local health departments at the state, at the national level. We have a graduate that works at Centers for Disease Control and Prevention, but we also have graduates that are working for insurance companies, in part because insurance companies want to have healthy people that they cover, but they also want to have healthy employees. So many businesses have health promotion majors, work with public health, and I have graduates that work in the military. I have graduates that work for what we lovingly refer to as the organ organizations like the American Heart, the American Lung, but also things like American Cancer Society, leukemia, lymphoma. So know that our work is dynamic. We are never bored. We are never bored. And that everybody really does want healthy people. And so our goal is for the healthy choice to be the easy choice so that we can all live, work, and play in healthier ways. So in this degree, we have 3 options. We have a general, which really has a large amount of flexibility so that people can add different minors and certificates if they want. We have the health education and promotion, which is a major a group that I work with, and students who graduate are eligible to sit for a national certification, and we have a great pass rate. And then we also have environmental, occupational health, and safety. So as you can see towards the bottom of that wordle, there's environmental health, food safety, emergency preparedness, and we even have a great special topics class this semester about environmental hazards and emergency preparedness. So we are a growing field. The number of majors that we've had has doubled since last semester. And I am very eager to talk with you and to see what options that you have. And please know that we are all here to assist you. And what we think we want to do when we first come to college and where we end up can oftentimes be different places. But no matter what, there is a place for you. And hopefully public health can be one of those things that you would like to explore. Thank you.
Thank you, Callie. Do we have questions for Callie? All right, a virtual round of applause. Thank you so much.
All right. And I don't know if Thomas Kimble is here today or not.
I'm right here.
Oh,
He's
there you
right
are. Okay,
there.
sorry. Thomas, here you go.
Thank you. And thank you so much for having me here today. And thank you, Kelly, for talking about public health. And I'm going to segue into working with the public health online program. So I'm a student success coach who works with Boise State Online, and I work with our Bachelor of Arts in Public Health. So what's a lot of students are always wondering, is, it's a Bachelor of Arts as opposed to a Bachelor of Science. So what our degree really does focus on is that health education and promotion focus. So when I talk with a lot of our students, a lot of them are having a passion to provide, equitable health services to their community. And so that can be in multiple ways, whether they're working in nonprofits, whether they're working, as like healthcare administrators. And as you can see, the types of jobs, I've just posted a few, like public administrator, community health worker, public health program specialist. It's a lot of really great avenues. There are so many different avenues you can go down in public health. So as Kelly specified, you can definitely obtain what is called the Certified Health Education Specialist credential, the national credential she was discussing, and it's really huge to have that. My students get really excited when they can get their bachelor's degree on top of that credential, and that's so awesome. They're super excited about that. One really cool thing, and I know that this person will be talking soon, is you will have the option to work one-on-one with a career coach, and that will be Kelsey Nelson, who's talking soon, who works directly with the College of Health Sciences. So if you have any questions or are wondering what can I do with a public health degree, Kelsey is a rock star who can talk a little bit more about that, as well as so can I. One really cool thing about working with our fully online program for public health is that you do have your program plan crafted from start to finish in your first advising appointment. So you're going to have all your courses crafted, whether you're wanting to go full-time or part-time. So there's a little bit different. The courses are a little bit different in regards to, you do have 2 7-week sections a semester. So that is a little bit different. And also in terms of cost for the program, you're paying per credit hour. So it's a little bit different than the full tuition cost. And then another one thing is that this program is 100% online, never having to need to come to campus if you are unable to, or if you have to move out of state for any reason. And I know right now during COVID, a lot of people are staying indoors. So if you do have any questions about our fully online program, I am happy to talk with you about it.
Oh, that's excellent. Does anyone have questions for Tom?
This is Dr. Spear, and
Yeah.
I don't have a question for Tom, but I do want the students to know that so far we have 100% pass rate for the students who are in the online public health program with the Certified Health Education Specialist exam.
Thank you so much, Dr. Spear.
Thank you. Thank you both. That was wonderful. Virtual applause.
Of course.
All right. If no questions pop up in chat, we will go on to our next presenter.
Yeah, and to our speakers, if you guys want to post your contact information in the chat, that would be great, so our students can have that. Thank you. Okay, so we'll move on and we'll hear from Olga.
Unmuting there. Wonderful. Thank you so much. I am really happy to discuss these 2 options for you. I often talk to my students about clinical undergraduate programs. Certainly, within the College of Health Sciences, we're preparing our students. They can go on to thinking about graduate schools as well, right? If they might want to go into an accelerated nursing program, or they might want to consider going PA, PT, or something along those lines. We can help you with that as well. But I'd like to cover 2 undergraduate clinical programs, because if you're thinking, no, what I would really like is to be in a hands-on kind of patient care position. That's really my goal. And maybe it's nursing, or maybe now I'm thinking about maybe there's more opportunities for me in other fields. These are 2 that you'd really want to consider. Please note that both of these programs are very well known across the nation, and our students are all over the place, both locally employed upon graduation. We have 100% employment rates, or they've gone nationally as well. So we have students stationed who have taken positions at Cleveland Clinic, at Boston, Mass. They are nationwide. And for those of you who think about maybe leaving the Boise area, I mean, this is your opportunity to do that as well. Go. I mean, you can always go and come back, but the experiences that you get by leaving the state and being in new places, being travel radiology, travel respiratory care, wonderful experiences for you as well. So our graduates graduate with bachelor's degrees in these programs, and that's kind of an important distinction I want to make. A radiologic technologist and a respiratory care therapist are at the advanced levels of certification. There's beginning levels, and then there's the next. And for our students, they are in that more advanced level where they can take on training and supervisory responsibilities for the organizations that they work for. As such, they are preferred candidates when it comes to employment. Radiologic technologists are experts in imaging. Respiratory care therapists are experts in cardiorenal therapies, treatments, diagnosis. Both of these healthcare professionals are hands-on patient care and are critical to the medical team. When you're talking bedside treatment, respiratory care therapists are probably next to nurses. They are there bedside the most. Radiologic technologists are working potentially bedside because they come in to do imaging kind of work, but they're not going to typically doing the continuation work unless they're going into some field like radiation therapy. Okay. The prerequisites you will find that for radiology and respiratory care and nursing are so common. The English 101, 102, the anatomy and the physiology that full year, your chemistry course, your psych 101, all across the board, right? So you are already taking on big pieces of that. The only thing I would suggest that if you are planning on your statistics course, which statistics course you would take, my suggestion would be the Math 254 if you're looking at respiratory care therapy, because that is their preferred stats class, Math 254. In addition, radiologic sciences would like to see college algebra, which is Math 143. The review of the applicants of this program, I'd like to describe that as being a little bit more holistic. Okay, so our application is going to take a look at your cover statement. What are you bringing to the table that's above and beyond the courses? Sometimes students tell me things like, well, you know, I only have a part-time job and I've been working retail. I've been working as a barista. Are you kidding me? Those are excellent transferable skill sets and we want to hear about them. If you've had some experience working in healthcare, that's also a plus, whether you've worked at it as a volunteer or whether you're working for pay. We want to hear about that. Both of these programs do interviews. So they're a little different in how they do it. The radiology program has a very short kind of quick interview process, whereas respiratory care, it's kind of a grueling 2-hour or more process, but they both have interview processes where your strengths and your skill sets can come forward during the application review. The difference between nursing and these two programs, however, is that we only admit once a year. It is a separate application process. You will apply, typically students submit their applications in the spring. And radiology's application is due by the second Friday in February. I don't like that. I always tell my students, just think February 1. February 1 is your goal to get the application in if you're thinking about radiology. For respiratory care, you have until March 1 to submit your application. Okay, there is one point I want to make right now, really, really important. If you feel that you are ready to consider radiology and you have done most of the prereqs, let's say you're done with your bio 227 and 228, maybe you're in chem and you're thinking about radiology. The reason I want to bring this one up in particular is that radiology is doing an application review, explaining the application, a virtual session on Monday, the 26th at noon. If you are interested in participating, again, these are for people who have gotten a little further down the road in terms of prereqs and they're thinking they're ready to apply during this spring. If you think that that's a possibility for you, then please go on to the radiology webpage, scroll down because you have to RSVP so that they can send you the link. Again, the event will be on Monday at noon. Thank you, Ellie. Thank you, everybody.
Oh, thank you. Can you maybe give them the link so that if they want to attend, they will be able to?
I will put that in the chat.
Oh, thank you so much.
It'll be the RSVP link.
Awesome. Any questions for the amazing Olga Salinas? All right, virtual applause.
Thank you.
Thank you so much,
Virtual
Olga.
bow.
Thanks so much, Olga. So now we'll move on and we will hear from Jamie Sand about health studies.
Good morning. Thank you for having me. It's still morning for about 20 minutes. I'm still going to go with good morning. I'm Jamie Sand. I am from the Department of Community and Environmental Health with Dr. Spear. We have the public health degree, but we also have a Bachelor of Science in Health Studies. So I wanted to talk with you guys about that a little bit today. It's built more as a general health degree. And so it really does, like kinesiology, like public health, like radiology and respiratory care, pretty much all of your nursing prerequisites come right over. So it's pretty easy to transition if you wanted to change your major, or even to double major if that's what you wanted to do. We house all of those courses that start with the prefix HLTH. So things like nursing and pathophysiology, if you've taken those already, you've already had a class from us. Within this degree, we have 3 emphasis areas. We have the general emphasis, informatics and information management emphasis, and the science emphasis. The general and science are really set up to be flexible and allowing students to really kind of tailor courses of interest, perhaps throw in a minor or a certificate, or maybe a few minors and certificates, or to add in prerequisites for perhaps a graduate program, or you could even be looking at something like a fast track nursing program. You can squeeze in all of those courses that you would need right into the degree. The health informatics and information management, slightly less flexible, a little bit more tailored. That's actually my background. Within that emphasis, we're really focusing on health data. So looking at that health record, what needs to be documented in the record? How do we document it? How do we make sure it's quality information that's in there? How do we make it private yet accessible? If you go into nursing, you're going to need to access that patient record. HIM also covers how we pay for healthcare. So it gets into coding and reimbursement and the revenue cycle, and then how we use that data that we're gathering to make decisions. So whether we're looking at decisions for patient care and better patient outcomes, or they can even be business decisions for the facility. I actually have a student double majoring in nursing and HIM right now. I've had a few students do that. Definitely takes a few more classes, but they really complement each other. If you're thinking, if you're still going the nursing route and you're thinking you might want to go on the administrative side, maybe into something like clinical documentation integrity, or even into nursing informatics, this is a really nice complement to your clinical practice that you have within your nursing degree. We also have a minor and certificate in health data management. So if you wanted kind of a little dabble in that area, but maybe not a full double major, those are also options for you. Within all 3 emphasis areas, we do not have any admission requirements. So there's no prerequisites to get in, and there's no application cycle for it. You can just jump in anytime that you're ready. You can see that there's a variety of careers kind of down at the bottom of the slide. Really, if you kind of think about, everything in healthcare that's built to support those of you that go into direct patient care, that's kind of our world. So you might go into, patient navigation and working directly with patients on more of the administrative and financial side of things. You might go into, there's a variety of things in analytics, whether you're going into data analytics or financial analytics. Claims analyst would be an example. Or you could even go more on the lab and research side and do more of the assistance in terms of helping with research studies and research within the facility. So wide open doors, I would say, in health studies. You can really tailor it towards what you're interested in. So if you have any questions, please let me know. I will put my email in the chat. I did want to mention that Olga, who just spoke, and then Aaron Colburn out of advising are both very well versed on health studies as well, particularly on the general emphasis area if you have questions there. HIM, I'm probably your best contact, but we have some really talented advisors throughout the college. So just let me know if you have any questions.
Awesome. Thank you so much, Jamie. I should mention that I have a dear friend who went through Jamie's HIIM program and has been happily employed for the last 15 years plus with a large state agency. This is a really good choice if you are into data management and patient support. So, questions for Jamie?
Looks like we do have one. How could this benefit you as a double major if you were to do this alongside nursing? If you were employed as a nurse, would it allow you to do more?
I would say yes. General and science, I don't know that it would give you too much of a leg up. You could have, I mean, you'd have opportunity to take some additional classes just to kind of broaden your knowledge base. So that could help. HIM, I would definitely say yes. If you want to go, it's very, we kind of overlap a lot with nursing. If you have the emphasis, it gives you that foundation of the health record documentation, and particularly the coding and revenue cycle, which nurses are very involved in. I mentioned clinical documentation integrity. So that's the way that we code a record to submit claims is based on documentation in the record. And so nursing staff are incredibly important in helping us communicate with the physicians and reviewing that patient record while the patient's in house to make sure that the documentation is clear. We have kind of an adage, if it wasn't documented, it wasn't done, and thus you can't get paid for it. So I think anything in that kind of realm of nursing, this gives a really nice solid foundation for you. And I do think it would make a difference if you wanted to go more into that administrative side. Nursing informatics is another one I mentioned that's becoming more and more necessary in different facilities. So having that kind of specialty understanding, I always tell our students, we're kind of that liaison between the really techie IT people and our clinical staff. And nursing informatics kind of does that as well. So you can speak the language of the physicians and the nurses and the other clinical staff, but you can also speak at least a little bit of the language of the IT staff to make sure that that electronic health record is going to work for the end users, which is you as a nurse or the physician, et cetera.
Other follow-up questions, please? Awesome. Jamie, thank you so much. Virtual applause.
Hear from Nikki talking about social work.
Great, thank you. Hi, everyone. My name is Nicky O'Reilly. I am the program coordinator for our BSW program here at Boise State. So before I get into some of how this transfers over, well, just a little bit about the field of social work. I imagine most of you are familiar with it, but might not know a whole lot about what you can do with a degree in social work, in particular a BSW. So our students work in a wide variety of settings around the community and with a lot of different populations. So we have students who work in housing and homelessness, substance use, behavioral health, both adult and juvenile corrections, intimate partner violence, just to name a few. And in a variety of types of agencies. So we have a lot of students who work for the state of Idaho or other state organizations. And we have students that frequently are working in not-for-profit organizations as well. So one of the really cool things about social work is that it gives you a set of skills that translates to a wide variety of settings and the ability to work with a lot of different people. So it's a pretty versatile degree, which is one of the great things about it. And it is also an area that is seeing growth in terms of employment. So Department of Labor statistics have estimated, I think, approximately 11% growth over the next few years in the field of social work. So there's a great need for people to be working in the field of social work. So one of the great things for nursing students is, Ellie and Olga put this together where they've kind of identified some of the things that transfer over really easily. And nursing students who end up choosing another path later on often fit really well with the field of social work because the strong background in biology fits really well. Social work uses what we call a biopsychosocial model. And so it's a really good fit coming from nursing to social work. The other thing is a lot of our students do end up working in healthcare settings. Frequently, there are some case management positions at the undergraduate level, but a lot of our students end up going on and work as hospital social workers once they get their graduate degree. We take applications twice a year. So we do applications the first Friday of October and the first Friday of March. So similar to what Olga said, if you just shoot for the 1st of October and the 1st of March, or the 1st of March, you're good. So those two application cycles, if you were to apply in the spring to start in the fall, you would complete your social work degree in 4 semesters. And if you applied in the fall to start in the spring, you would be able to do it in 3 semesters, of course, contingent on completing your 120 credits. In the application process, we are looking to make sure that students have completed certain prerequisites. And when you look at this chart here, you can see a lot of those things are already done. So you might just need to take 1 additional semester of classes in order to be ready to apply. So we have here some things you would need would be econ, political science, Social 230, which is Intro to Ethnic Studies, and then our introductory Social Work 101 and Social Work 201. So a lot of students come in and they're really in a good spot to transfer over to applying to the social work program. Similar to how Olga was talking about with the radiologic sciences, we do have a more holistic approach to our application. So GPA is included in there, but it is not the main factor that we use to decide on applications. Our students complete 2 essays in the application process. We are also looking at work, if you have work experience, as well as any sort of volunteerism or community service, particularly in fields that would be related to social work. We like to see that as well and take that into consideration, as well as speaking a second or third language and things of that nature. So there are a lot of things that go into our decision-making process. In terms of when you do complete the social work program, one of the great things about a BSW is you can go out and you can be licensed as a bachelor's level social worker in the state of Idaho and many other states across the country, and you can start working right away. So it does not require a graduate degree like many other helping professions do. So a lot of other areas of counseling and psychology actually require you to get a graduate degree before you can really start working in those areas. Social work does have an MSW program, and the other great thing about it is if you complete a BSW from an accredited program, which we are, you can then apply for an advanced standing program when you are ready to go to graduate school, and you complete your MSW in 1 year. So there are a lot of really cool things about it when you're thinking about how you might want to get out there and be in the working world and working with people. So I think that's it. I don't know if I missed anything or if anybody has any questions, but I'm happy to answer any questions, and I'll include a link to our website as well as my email to help so that you can contact me if anything comes up later.
Awesome. Nikki, thank you so much. I do have a follow-up question.
Oh, thank you.
Can you talk so briefly about what strengths-based perspective means? Because nursing students don't necessarily transfer over to social work students without needing to understand collaboration.
So we operate on a strengths-based perspective. So it's one of the models that we operate in social work. And what it really is about everybody who we come into contact with or comes to us or we are working with or on behalf of, everyone has a strength, right? Even when people feel like they're maybe struggling the most they've ever struggled, there is something for us to build on, right? So we really take that approach to our interactions with our clients. And we also take, I feel like as a faculty, we take that approach when working with our students as well. So it's an important part of the social work model. Hope that answered your question, Ellie.
Awesome. Yes, it did. Thank you so much. Do we have any questions for Nikki before we move on to me talking about I only want to be a nurse? Okay. Thank you all so much. Okay. This is Ellie. Nursing is 100% of what I want to do. Well, I get that, and I work with students who are in that place all the time. There are other nursing programs out there. I have been working very closely with my amazing peer advisor, Jacob Allen, and I'm going to pitch to him now to talk to you a little bit about what he has learned about other schools in our region to which you could apply, either having finished a degree in something like health studies or as a transfer student.
Awesome. Thank you, Ellie. Hi, everyone. So I've been working on this little project. Ellie and I have been, it's a spreadsheet full of information, useful information about other nursing programs that are out there. Typically, most of them are pretty close to Idaho, but some of them might be a little farther out. But this spreadsheet that we've worked on includes a ton of information that you might find useful, including tuition, how many students are accepted into the program annually, application deadlines, and there's a ton of links on there that can direct you to the program where you can read even more about it. And something else that we did is we took all of the classes that you take at Boise State for the nursing program. So English 101, English 102, your anatomy and physiology, all those courses that you would typically, or that you would see on the grid. And we used our equivalency system as well as equivalency systems from other schools. And we tried to see where the classes lined up and if the classes would transfer over. And a lot of the classes that we found that would transfer over pretty seamlessly are a lot of your foundation courses. So your English, your sociology, your chemistry, anatomy, physiology, from across a lot of different schools, those courses transferred pretty well. But you can find a lot of that information on this spreadsheet that we created. And just like Ellie said, another option that a lot of students look to if Boise State isn't the right fit is they will finish their degree at Boise State, get their bachelor's at Boise State, and then look look at other nursing programs, especially the accelerated nursing programs, and look to apply to those if they really want to do nursing. So just know that there's tons of options out there if you really do want to be a nurse. And if you do want to talk about this spreadsheet and look at it with me, please feel free to set up an appointment with me. I'll put my email in the chat and we can talk about it. It can be a little intimidating to look at it first, so I'd like to sit down with you and walk you through it so you can find it most useful. But yeah, I'll put my email in the chat and we can talk about it.
Awesome. Thank you so much, Jacob. So now we're going to move forward and hear from Kelsey Nelson.
Good morning, everybody. My name is Kelsey Nelson, and I am the Career Success Coach for the College of Health Sciences. I'm a member of the Career Services team, and I specifically focus on student career development with all of the wonderful students within the College of Health Sciences. Typically, this often involves interviewing, job searches, resumes, and for many people, it's career and major exploration. Now, I'm not here to discuss a particular academic program, and rather just want to share that I'm here as a resource to help you take all of the knowledge that you are gaining as a student and the experiences that you're having and use that information to identify, set, and achieve professional goals. I show these images below or in the middle of my screen because so often individuals think that a path to a career is very linear, where you go to college, you take your classes, and then you're in your career. Now, this could be the case, and it is the case for some people. However, most often it resembles the second image on the right, where it's more of a roller coaster. That roller coaster is because college is full of experiences, whether it be classes, projects, conversations that you have with faculty, advisors, mentors. And I want you to lean into those experiences and learn a little bit, not just learn about the content, but learn about what gets you excited and what doesn't get you excited, what motivates you and why. All of these experiences and knowledge impact your career decision-making and can help you narrow down what types of careers interest you and careers that would help you feel or make you feel fulfilled and you would be successful in. You're going to grow as a person while you are enrolled as a student, and it's okay to listen to how these different experiences are shaping you. I have a lot of conversations with students that are in the realm of, I know I want to be in healthcare and I'm not sure how, or what other options are out there, or what can I do with blank major? In these conversations, the goal is really to help you identify what your interests are, what your values are, and then careers that align with those interests and values. A lot of the time we also talk about different clinical career paths, non-clinical career paths, and then really help you focus on exposure to explore different majors and career opportunities. I also have a lot of tools to help you explore this. So please know that I'm a resource for you in your career exploration. So I'll put my email in the contact or in the chat, and let me know if you have any questions.
Great. Thanks so much, Kelsey. Yeah, we work pretty closely with Kelsey for a student who might kind of think a different career path is what they're looking for. So she's a great resource. And we will hear from Megan.
Hey everyone, my name is Megan Lindbeck and I am the Major Exploration Coordinator in the Advising and Academic Support Center on campus. We normally are working with our undeclared and exploring student population. I'll try to be pretty brief and quick because I know we're sort of out of time, but I'm here to talk about exploring a parallel plan outside of the health sciences, which maybe isn't where your mind is at right now, but we'll talk a little bit about that in a second. There's a lot of different areas of study and work available to you. And even though you have a big interest within health right now, taking a look at what else Boise State has to offer is a smart move, if only to be sure of your desire to study in health. That's fine too. Boise State has resources to help you with this potential journey, and some of them start with either our major exploration team or our career services team that does career exploration, which is Kelsey is a part of. Major exploration is housed within AASC, where I work, and we can offer students support in exploring potential majors of interest, showing them how their credits would work towards these different majors, and maybe walking them through some of the major required courses. Our career services office, among a lot of other things that they do, houses our personality and interest assessments, which can be really powerful tools for students who are looking to discover a little bit more about themselves first and sort of build up their self-knowledge. This exploration can help inform students about what major or career fits them and their interests, their values, their goals, etc. I'm really looking into this awesome assessment that students have access to do at any time that I'm going to talk to you about in a second. It's called Pathway U. So the Pathway U career assessment is something that you can do now to not only potentially confirm your interest and compatibility with nursing, that's something you can do with this, but also maybe open your mind to other areas you might be interested in or skilled at. I've put the link in the chat below, but if we go to the next slide, I'm going to show you a little bit about it. So to access Pathway U, you simply go to the Career Services website, click on Get Career Help, where you see that little orange arrow in the corner. Next slide. And then when you click on that, it'll bring you to this page and you can click on the Pathway U career assessment right there. Next slide. This is going to bring you to the assessment landing page with some instructions on how to set up your account and guide you through 4 different mini assessments. So these assessments are going to be your interests, your personality, your workplace preferences, and your values. All 4 of those things are super important to understanding who you are, and especially who you are in the world of work, the criteria that you want to come up with to create a profile and a self-knowledge of a career that you would want. Next slide. So after you do the assessments, you can view the results and you can learn more about yourself, what career might fit you. This isn't meant to be a magic test by any means. That's going to tell you exactly what you should do with your life, but it is a really cool, free tool that you can use to start exploring now. You can even click on the View Career Matches button in the corner right by that orange arrow of the results page to see what field or subject fits you best. So if we go next slide, I'm going to give you a little brief look. So this is my own personal result from taking the Pathway U assessment. So you can see that education came through as a really strong match for me career-wise. And specifically, if I clicked further into it, it said educational advising was my top career match choice, which is great because that's where I'm currently at. So that's really comforting to me to see how this tool showed myself and my compatibility to my career. Next slide. So lastly, you can make an appointment with a major exploration advisor to discuss your interests in various majors and see how your nursing courses might work towards a potential new degree of interest. And you can do that by meeting with a major exploration advisor. So as Ellie mentioned previously, many of your nursing prereqs could transfer over to other majors. However, all majors are different. And while every Boise State student does need to complete the same foundational categories, right, like the science, the humanities, the social, like nursing, some majors have very specific courses chosen for you in those categories. So for this reason, it's a really good idea to meet with an advisor to see how many of your pre-nursing coursework would translate to a new degree, a new major, and then how much would become elective credit and how elective credit could work in that new major. So you can head to ASC's website and find that that button that says find your academic advisor to make an appointment with an exploration advisor as well. Thank you.
Oh, Megan, thank you so much. Do any of you have questions for Megan? All right, I apologize that we had so much great information to give you that we have run a little bit long. So in group chat, all of my amazing team of pre-nursing advisors are going to once again post their email information, and you can reach out to us if you have questions as follow-up to this event. I want to thank you again so much for attending, and I hope so much that you will go ahead and use our itty-bitty survey to tell us how we did. Thank you again. I am Ellie Pierce. Does anybody want to chime in?
I think we are good. If you guys do have any standing questions, feel free to email us those questions and we can connect you with the right people. But Jacob, I think you can go ahead and stop recording, and thank you, everybody.